So basically today's video is going to be about my BBL. So first things first, yes, I had BBL done in June with Lipo 360. They lipoed my arms, my stomach, my back, and like upper back right here, like where your bra is. And then of course they took all that fat and then put it into my butt. So I didn't get like butt implants or any of that, just strictly they took the fat from the areas that I didn't want it at to make my booty bigger. And overall, I'm really happy with the results. And my doctor was Dr. SALAMA in Hollywood, Florida. It's like 30 minutes away from Miami. It's called Elite Plastic Surgery is the place. And sorry if I'm all over the place. If you guys have any questions or anything, just leave a comment down below and I will answer you. Because I know before surgery, I was trying to find like videos of people who went to Dr. Salama to try to get like their experiences. And my surgery was on June 4th. And I did get to Fort Lauderdale. I flew into Fort Lauderdale on June 2nd. And then I didn't leave until June 11th. So I was there for a couple days. Anyways, I stayed in a hotel. I did not stay in like a recovery home or anything. My mom went with me and she was able to take care of me. And I'm really glad that she was able to do so because I did need help doing a whole bunch of stuff, guys. Like, if you are going to have surgery, I really recommend having somebody that can help you, really comfortable around them because, you know, they're gonna be seeing you like naked and helping you do everything pretty much. And my mom was amazing. Like, I'm so glad that she went with me. Surgery cost, like in total, it was $7,299. That is not with hotel and flight included, like your medicines, your food, and then of course like all the things that you need to buy for your surgery, which again, I can do another video on that, on exactly what you need, but you do need quite a few things. Okay, y'all, I had to start over because they came outside and didn't realize that I was recording, but that's okay. So we're just gonna pick up where we left off. So in total, like for everything for surgery, I would say I paid close to like $10,000. So if you're planning on having the surgery, I would definitely recommend to start saving now. Just make sure you have like enough money to go as well, not just like to pay for your surgery. You're gonna need money for everything else. And the deposit was $700. I remember calling back in January, and then again, I didn't have my surgery until June. And I just called, I had already sent them my photos, the doctor reviewed it, and he was like, yes, I think that you have enough fat to see a difference, like to make a difference in your butt and stuff. So then I ended up calling and I was like, okay, cool, can I just go ahead and book already? I went ahead and paid the $700 deposit in January, and then I booked for June. So at that moment, I was like, there is no turning back. Like, girl, you done put this $700 up, like you're having this surgery. So yeah, once I did that, it still didn't feel real. Like, I would talk about it like, oh my gosh, I'm getting ready to have surgery, but I was like nervous, but then it also just didn't feel real. And honestly, it still didn't feel real like once I got to the surgery center and like I met with Dr. Salama June 3rd, the next morning. So I went, they tested me for COVID. Good thing they didn't do like the test up my nose. They just like pricked my finger and then like a throat swab. I did not meet Dr. Salama, guys, until the day of surgery. Okay, my pre-op, I honestly thought that I was going to meet Dr. Salama. I did not. I did not meet him until the next morning of surgery. Like, I pretty much did the COVID test and everything. And then Naomi was like, okay, we'll see you tomorrow. I believe my surgery was at 8 a.m. and they wanted me there at 7. I show up the next day for surgery. You have to put like a little patch behind your ear the day before, and then you can't eat anything like past like midnight the day. I got there and then like got changed up into like the surgery gown or whatever, and then Dr. Salama comes in and he, you know, I get fully undressed and he's just like looking at my body and figuring out like where he's gonna get the fat from, like marking me up and stuff. And I was 120 prior to surgery, and they had told me months before they recommended me going up to 127. That way, you know, I could get like more fat, my butt could be bigger basically. Unfortunately, I was not able to gain any weight at all. I was still 120 when I went in for surgery. So I did like ask him, like, if you're not able to make my butt bigger or like for me to see a difference, then I don't even want to do the surgery. He did tell me that there would be a difference. Okay, cool. So he started marking me up, and then I went into surgery, guys. Like, he asked me, do you have any questions? Also, I know a lot of girls show like wish pics. I honestly did have some, but I don't know, I just ended up not showing him any of the wish pics. Like, I just told him, like, I just want to be snatched, okay? Just snatch my waist and just give me a booty, okay? Because your girl has no booty. And he was like, okay, we will do that. And then he was like, okay, I will see you in the surgery room. And I go in there. All I remember is the anesthesia doctor like asking me questions or whatever, and I started talking about my daughter, and he's like, you might taste a little bit of medicine, but I'm just getting ready to like start the medicine. Okay, in my head I'm thinking like, okay, that's just like, I don't know, like fluids or something. I didn't know that he was talking about that's what was gonna knock me out. Boom, I was out like a light. And then I wake up and I'm blind, so I have glasses. Right now I'm wearing contacts, but I have glasses. So when I wake up, I'm in this like bright room, and I'm like, oh my gosh, am I alive or am I dead? And then the nurses are just like, they come around me and they're like, oh, you made it through, mama, like you're good. Like everybody was really nice, guys. And then they give me my glasses and I'm there. They ask me if I'm thirsty, they give me some apple juice, and then I'm like, I gotta go pee. So I get up like nothing, you know, like, I'm just like, dang, it really don't feel like I just had surgery. But I think it's because like all the medicine was still in my system. I get up like nothing, I'm walking, and then I go to the restroom, and then my mom pulls up, and they wheel me out, and I get in the car, and my mom's like, dang girl, like, you can like walk and everything. And she was thinking that she was gonna have to help me into the car and everything, and I'm like, yeah, I got it. So then we get back to the hotel, and I just go straight to bed. Like, I'm just laying there, okay? I take a little nap, probably like a 20-minute nap, and then I wake up. Yeah, no, okay? The anesthesia medicine or whatever that was in my system was terrible, okay? I started like puking, I was pale, and again, it's not anything that the doctor did. It was just like, it was just me, like my body reacting to the anesthesia or whatever. I was just glad that I was alive and I made it through. But again, I just kind of kept like a positive attitude before surgery. And then obviously after surgery, you just want to like try to be positive. Although I tried so hard to eat, guys, to drink, and I couldn't keep anything down. Like, I'm talking, we spent like hundreds of dollars. Like, that's not even over exaggerating. Just on like snacks and food, like every day, just trying to eat. And I wouldn't say that, I would say that I didn't start eating like I was supposed to until like June 12th, and I had surgery on June 4th, guys. So yeah, it was hard eating and all that. I was puking a lot, and my mom was like freaked out. So for the most part, like, I was just in bed, just dead. And my birthday was on June 9, guys, June 9. And I thought that like I was gonna have energy to at least go out to eat or head up to like Miami, and like, no, that did not happen. Like, I was miserable for a while. As far as like showering and all that, my mom had to bathe me. Like, she would just like wipe down my body and stuff. The next day I had my first massage. I was so scared for that because I know a lot of people were like, they're really painful. So I had and then to have one like the day right after surgery was like so scary to me. And it was pretty painful, but I feel like I handled pain pretty well. So like, it was okay. I don't know, I mean, yeah, it hurt, but I needed the. And then I remember like my second massage was probably the worst one because I had like fluid pockets start to gather like in your stomach from the lipo. And I remember there was like fluid stuck on my back, and she was just like trying to like push it to the front because she said it just wasn't going anywhere like in the back, so she had to push it to the front to try to like push it through my drains, because I had drains, guys. So I was really scared about that too because I got sent home with them. But anyways, like I said, there's just so much to like know about this whole process and like procedure that I had done. But anyways, yeah, I like remember her like pushing it to the front, and I was like like I said, it was painful, but I was just like, I wasn't saying anything about it. I was just like dealing with the pain, because like what else can you really do? You have to get it done. So I just remember finally like, oh my gosh, wait, I can't do this. And then her name was Wally, and she's great. Like, if you follow their Instagram page, then you will see her on there. She does like Wally Wednesdays and stuff, like videos of just things to know before your BBL and like after. So anyways, yes, she was like pushing it to the front, and she's like, I know, I'm sorry, but like we have to get it out. And the pain, I would describe it as like, I felt like I was being like burned and cut open at the same time when she was pushing the fluid. But again, you just have to deal with it. However, I really wasn't taking my pain medication because it made me sick. So pretty much I was just going through the pain and just handling it, because what else could I do? So yeah, that was the massages. And then the drains, like the day before I was going to leave, they did take my butt drain out. So like, it's at your like little tailbone kind of. They did take that one out of me, but then they were like, well, you're still draining a little bit, so we're gonna keep your front drain in. And I was like, oh gosh, no, because then that means that I get sent home with the drain, guys, and somebody over here was gonna have to take it out of me, and that was gonna be my mom. My mom was not gonna know how to do that. Sure enough, she didn't know how to do it, so then I had to call my cousin, and she came and did it for me. When she pulled it out, I felt like a little bit of the pain, but then I was like, okay girl, you're just gonna have to like yank it out just to get it over with. So she did, and then when she did, it was burning really bad, like all right here. The drain's like from right here to like over here, so it's like in your freaking stomach, okay? And like your skin starts to grow around it, and so yeah, it hurts. Whenever she took it out, that space was probably like empty, and it was burning. So anyways, there's that, guys. I know I'm all over the place, like I said. I don't know. You can't sit for a while. I am almost 3 months post-op, and I am already sitting without my BBL pillow. When I drive, I do use it, or if I'm at home, I will use it sometimes. However, right now I'm sitting on my booty, and I think that I'm doing just fine. My booty right after surgery was not automatically bruised, but then like a couple of days later, I was bruised. My booty was really big, like really big right after surgery. Obviously it's gonna be like that because you're swollen, so it has gone down some. So as far as like eating and drinking, if you're able to, please force yourself, because you will feel better. But I think that for me, it was just like the anesthesia in my system. I wasn't able to hold anything down. Like I would literally just be puking all the time. And then you want to wear your faja. Honestly, I'm going to be completely honest, like you have to sleep in your faja and stuff, but I'm pretty sure like either the first night or the second night, I just had to come out of it. No, I changed that. It was the second night, because they ended up changing my faja, I'm pretty sure, into a smaller one, and I literally felt like I couldn't breathe. You're supposed to feel like that because it's like squeezing all that fluid in your stomach. But honestly, I would take off my faja because I just couldn't, like I couldn't sleep and I couldn't handle it. So yes, wear your faja as much as possible. And then again, I will make another video of other questions you guys have. I know this was like all over the place and stuff. Ask me questions, and then I will make another video on that. And then I will come back again if I'm making a video, girl. I will come back with another video if I think of, or another part if I think of anything else that I missed. Why she standing like that? Yeah, it's really hot out here, guys, but I'm only out here because of the sun. So yeah, just anyways, try to eat as much as you can and drink as much as you can. Some girls don't react to the anesthesia the same way that I did, so I'm not saying that you are going to be miserable for a whole week. And some, like me, I'm just saying be prepared. But you will get through it, girl, and you will have that banging body that you want. So if you're looking to get a BBL, then I would recommend Dr. Salama. Like I said, everything went great and everybody there was nice. So anyways, like this video and leave a comment down below if you guys have any other questions. Bye.